All right, Chris,
Fantastic.
the floor is yours.
Thanks so much, David, for the introduction as well as the technical assistance. It's great to be here this afternoon and take a very different tact to this opportunity, what we're calling a next generation point of contact saliva-based bioanalyzer. Not sure how much you know about the point of contact device market, but within the diagnostics market itself, this platform is currently valued around $33 billion and growing rapidly. Why such a big market? Well, we've got a number of very significant drivers, not the least of which is COVID-19. But also the increased prevalence of a number of infectious diseases. We've got worldwide growing cases of diabetes, worldwide growing cases of cancer. Everybody wants to figure out what's going on with their health faster. We certainly recognize that within this market, there are a number of market challenges and barriers to entry. Nonetheless, we also see these as great advantages once you're able to penetrate through. So what do we mean when we're talking about biomarkers? Well, we see this as a very underutilized source of patient health information. There's a number of reasons for that. First of all, the current testing is expensive, invasive, and centralized. I'm sure everybody on this call at one point in the last couple of years queued up for some COVID testing. You know, it was really only towards the end of that we clued out that these were super spreader events themselves and decentralized that. But even when we decentralized it, we had to have a complex transportation system behind the scenes, coordinating all of these samples and bring them to a centralized testing. We're currently, as a society, and what I mean for that is unless you're incredibly rich and monitoring your individual health, we're not using any biomarkers for health monitoring. And we feel that many useful biomarkers exist, but they're not being used because of a lack of a reliable, rapid, and accurate, cost-effective alternative. So let's talk a little bit about the use of saliva sampling for point of contact devices. Now, we all know saliva can be collected relatively non-invasively, and it has a large variety of target biomolecules, including a number of biomolecules that are in very low concentration levels, including many hormones. We also know that from the top 50 ordered blood tests, more than 20 biomarkers for these tests exist within your saliva. And these are biomarkers for oncology, for cardiology, for liver diseases, for other blood disorders, etc., general health biomarkers included. We see a number of anticipated benefits and a number of users for an effective point of contact salivary-based device. First of all, primary healthcare providers. We see this as your local family physician using this as a screening tool to provide a holistic snapshot of your current health status within minutes of your health collection. We certainly see an opportunity here for specialists who can further monitor with increasing sensitivity your disease progression. Relatedly, long-term care facilities, certainly an area where we are spending an increasing percentage of our healthcare dollars, and one where we've got an incredibly diseased population residing. And lastly, but not least, isolated communities where we have very difficult, unfortunately, where we have a very difficult time of getting rapid diagnostic tests. There are only 2 point-of-care platform analyzers on the market, one made by Abbott, the other one by Siemens. Both of them will only use blood samples, and due to their very nature of design, they are not able to use any saliva-based testing. We see a great opportunity there. And so I want to introduce the solution that we have. We've developed a platform using saliva as a testing analyte that is able to test for multiple analytes at the same time. So it's got multiplexing capabilities. It provides a broad range of detection, anywhere down from picomolar ranges of some hormones. It allows for testing at incredibly low sample volumes, as little as 10 microliters. So out of a milliliter liter of saliva, you could conceivably have up to 100 different targets tested. At the stage it's currently at lab validation stage, it's showing great sensitivity and specificity to the target analytes. And most importantly, it is able to function at room temperature, including device fabrication at room temperature. Here's an obligatory science slide that I won't dwell over, but I draw your attention to the right-hand side of the screen, showing the design of this platform. It has a microfluidic channel embedded in between a surface consisting of an active surface as well as a transistor. And you can see in the bottom right is incredibly flexible. I mentioned we do have this now developed at lab scale. It's very early stage. We're calling this around TRL level 4. We have nonetheless gone out to the market for some conceptual feedback. And some of that feedback is summarized here. Overall, most users that we surveyed, albeit perhaps a biased sample, did express a general dissatisfaction with what was currently available. And we're looking, in fact, for a non-invasive assessment for quantifying biomarkers. We got positive reinforcement that this is a very easy to use and convenient test for using saliva, which is a great alternative to the brain scrape or blood-based testings that are currently available for various testing of diseases. Next steps with this early stage technology is we're moving into validation and prototype development, and then eventually, of course, manufacturing scale up. What we're looking for right now, we have not yet spun this technology out. It's very early days. We are looking for a partner who can help us with co-development or potentially licensing straight out of the gate right now, so that we might be able to do some other cool stuff in the lab. The team is led by Professor Ravi Prakash and is supported well by Teresa White from my team. Thank you so much, and happy to take any questions or comments.